Thank you for listening to the Business of Aesthetics podcast. This is Naren, the founder of this community. Today in our marketing tip, I'll be talking about why your practice isn't getting the number of patients it used to get. This is a question that many of you have written and asked us about, so I thought I'll address it. There could be lots of reasons, and I'm going to touch on some of those reasons. Perhaps you relied a lot on traditional marketing and it's not working anymore. So for example, flyers, magazines, TV, radio. And the reason is these mediums are one-way mediums, meaning when I'm watching a TV, I cannot ask questions, I cannot interact. And also a lot of the people who are watching that ad on TV, on the magazine is not even interested in, finding a spa or finding a dermatologist. So you are wasting your money talking to people who don't really even have a need. So for every, let's say 100 people who see your ad or see your mailer, only perhaps 3% are even interested. So you're wasting so much money. So when 97% of your money is wasted, you're not going to get results. Second, we live in a world of information overload. So these types of traditional marketing methods don't have the repetition you need to make a difference. Like for example, they used to say that people have to see you 6 or 7 times before they are interested in, looking at you and talking to you and possibly becoming a client. Today, that number is more like 50 times. So unless you have hundreds of thousands of dollars, you can't sustain a campaign on TV or radio or mailers to get in front of people so many times. The other reason perhaps your marketing is not working well is, you may not understand or you may not have really leaned into understanding how patients buy today. Today, patients have the control, right? They can go to Google, type in what they need, and get the answers for anything and everything they need in seconds. And they do that 8.5 billion times a day. So they don't wait for the mailer, they don't wait for an ad, they just go and look at it when they need it. So if I feel like going to a nice restaurant, I'm looking for it right now, when I'm booking that appointment or when I'm ready to go for that, lunch. Same way, when I'm interested in, having, looking a certain way before I go on vacation or for my job, that's when I start doing my research. So the question is, are you showing up when I'm doing my research? You can show up through ads or you can show up organically. If you show up through ads, they know it's an ad, so they don't trust you. So typically the cost is 5 to 10 times more than you showing up organically through search engine optimization. So once you understand how people are making decisions today, you want to optimize for it. You want to show up. You want to figure out, how do I show up when people type in the type of things that I can solve for them, whether it's Botox, whether it's some kind of a laser hair removal, whatever the service they're interested in, when they're looking for it, you should be the one showing up. So understand how people shop and then optimize your marketing for that. Now, that's still not enough, right? Not only you, many other people show up on Google. Why should they pick you? Do you have Google reviews? How many reviews are you getting every month? I would recommend minimum 10. If you want someone to do a complete audit, if you are having this issue of, hey, I used to get a lot more new patients that I'm getting right now, can someone look at things and tell me, what's going on and what can I do to improve? Book a marketing strategy meeting. It's our gift to you. It's a $900 gift. Go to businessofesthetics.org/MSM for marketing strategy meeting. We'll do a complete review of you, your competition. We'll give you a report card on how you are doing versus your competition. Also, we'll give you a plan on how you can turn things around within a reasonable time frame. So take advantage of this, find out where you are, and then once you have the knowledge, then you decide what you want to do with it. Once again, the link is businessofesthetics.org/MSM.
Welcome to another segment of the Business of Aesthetics podcast. I'm Michael Walker, your host for this episode. Before we get started, I want to thank all of our incredible listeners from the United States, Canada, and around the globe. We couldn't do this without your continuous support. A special thank you also goes out to our sponsor for this episode, Equa Marketing. With 20 years of experience, Equa Marketing is a leader in digital marketing services for aesthetic practices. As part of this podcast, they are offering our listeners a complimentary digital marketing consultation, which will include a tailor-made 12-month digital strategy for your practice. You'll be able to head over to businessofesthetics.org/MSM to book your consultation, but I'll share more about that opportunity a little later in the podcast and give you clear directions on how to get that all connected. But without further delay, let's dive into our theme for the day and join our guest. And the theme is automating weight and wellness programs, the future of patient care. And joining us today is Dr. Jonathan Kaplan. It is so great to have you with us today, Dr. Kaplan.
Thanks for having me. Glad to be back.
It is great to have you back, and we so appreciate your time and your talent and sharing that with us. But I'm going to go ahead and start off and share a little bit of your background with our listeners. So Dr. Kaplan is a board-certified plastic surgeon, currently resides in San Francisco, where he has established himself as a prominent figure in the field of plastic surgery. His journey into the world of plastic surgery began at the age of 16 when he witnessed a plastic surgeon in his hometown skillfully address a skin cancer removal case. Interesting. After completing his plastic surgery fellowship at the renowned Cleveland Clinic, where he was trained by the same team responsible for the first U.S. face transplant, Dr. Kaplan practiced in Baton Rouge, Louisiana for 6 years. During this time, he built a thriving cosmetic practice that encompassed a broad spectrum of procedures. Dr. Kaplan's commitment to transparency and patient-centered care led to BuildMyBod Health, a groundbreaking platform, and it allows patients to obtain itemized estimates for various medical procedures, eliminating the common quote-unquote sticker shock often associated with plastic surgery consultations. This innovative tool connects patients with doctors and empowers them with the knowledge they need to make informed decisions about their health care. Dr. Kaplan's dedication to accessible, informed healthcare exemplifies his unwavering commitment to improving the patient experience in plastic surgery. What a great profile. I have a feeling we might hear a little bit more of what's in that background, but I'm going to go ahead and jump right into the questions, Dr. Kaplan.
Great.
So the first question I have for you, can you just share with us what was the genesis of your passion? You sort of alluded to it there in your profile, but what was the genesis of your passion for aesthetic medicine and plastic surgery?
Yeah, I'm originally from Alexandria, Louisiana. I was the youngest of 7 children, and my dad was a general surgeon. And he was a general surgeon in the golden age of medicine, where there was not really any electronic medical records, not as much bureaucracy that would slow down your progress throughout the day. So he was home every night for dinner. So we had a good memories of my father always being available, being there for dinner. Not one of this like current days where the parent is never home. So he was always there, and we saw how much he enjoyed what he was doing. And so at the age of 4, even before I knew what it meant, somebody asked me what I wanted to be when I grew up, and they would tell the story repeatedly over the years that I said I wanted to be a surgeon back when I was 4. And so I started going to watch my dad operate when he was 11, when I was 11. But he would have been 53 at that point. But anyway, so I started watching him operate when I was 11, and thought it was incredible, thought it was so much fun, and then continued to go watch him operate. And then when I was 16, as you mentioned in my profile, I was in the doctor's lounge with my dad about to go watch him operate. And a plastic surgeon asked if I wanted to come watch the procedure he was doing. And it was not one of these glamorous, facelifts or breast augmentation. Back then, I don't think I really appreciated that a plastic surgeon did all those procedures. I really thought they did mostly reconstruction. And that was the procedure I watched. That the surgeon was taking off a skin cancer off a woman's leg, but the opening was too big to close primarily. So he took skin from her craggly, crinkly, wrinkly neck because she was a heavy smoker, and he took the skin out of her neck, replaced and closed the hole in her leg. But because she had such a craggly, wrinkly neck, that incision where he took the skin from her neck was lying right within a crease, and like you couldn't even tell she had surgery. It was really incredible. So that's when I knew I wanted to be a plastic surgeon, starting at 16, and then 18 years later, after college or the rest of high school and college, and med school and residency and fellowship, I was able to become a plastic surgeon. My first place of practice was, as you mentioned, in Baton Rouge, after finishing at the Cleveland Clinic.
What an amazing story. That's just such a lot of kids at 16, just the sight, I have a daughter who's a registered nurse, and we've always joked about, this little girl that just didn't like the sight of her own blood and didn't like this. And she has become, she works in emergency, loves trauma. It's amazing when you find that sweet spot in who you are and why you matter. I love that story. I have to say my story's not quite as glamorous, doctor. It was like I told my parents I wanted to get my hair cut just like Ringo and get a set of drums, and form my own band. And yeah, they got me a guitar. That was the substitute. So I
Close
went
enough.
on and did capitalize on that. That's another story, and for another time. But I'd love to hear a story. I mean, obviously that story with the lady, but for yourself, like for a favorite story on how your work has had a significant impact on a patient.
There's other stories across the years. Like for example, when I was first in Baton Rouge, I repaired a little girl's face after she got injured by a dog,
Mhm.
and then let's see, about 14 years later, they reached out to me on social media. After I'd already moved to San Francisco, and thanked me and sent a picture over. And she was a cute, adorable little girl, now a beautiful young woman, and they were just really appreciative. And so something as simple as that, just repairing a little girl's face, and now having a child of my own, realizing how devastating that could be, especially in the moment, how devastating that is for the parents, then knowing that you had a part in helping her recover. And, I can't take all the credit for it. I mean, I appreciate them thanking me, and I certainly was appreciative to them. But luckily, when you're a child that age, if you get treated quickly, you can really heal very well as you grow up from like being a 2 or 3 year old until you're like a 15-year-old. So the scars really did heal very well for her, and thankfully that was her own genetics and her own ability to heal. That I'm glad I can take a little bit of credit for it, but definitely it was her healing.
Thank you, doctor. It's interesting you bring that up. I have my daughter. She was bit in the face by a dog, and so I remember when that happened. I mean, the trauma of all that, this little person getting
Oh
bitten,
God.
and it was. And we went to the hospital, and I would, as much as I didn't know whether the plastic surgeon was the best one in the world or the worst or toughest, class or bottom, but one thing I know, and I can totally see that in you, he had this incredible empathy of care that made us just feel safe and comfortable. I could just sense that in you, how you approach that. So as much as you're an amazing surgeon, there's that other side of it, that relational side where, you just people in this business, it's so much about trust. And you just have a natural affinity to bringing that out. So I
Thanks.
remember, and her scar, they did an amazing job. Her scar was virtually
Imperceptible.
invisible. Yeah,
Yeah.
just a small little crease, a mark there. So today our theme is, as we mentioned, it was automating weight and wellness programs, the future of patient care. I'd love for you to kind of unpack that theme for us a bit and to share what it means to you and for our listeners.
Well, I think a little bit of background is necessary. As a plastic surgeon, people would be like, "Why is he talking about weight management?" And I'm happy for anybody to take me to task, like, "Oh, you're outside your lane. You're a plastic surgeon. What are you doing with weight loss, weight management?" And that's fine. But the truth is that I think doctors across America, maybe the whole world, we've always been treating the symptoms of different ailments, and the underlying cause for a lot of the symptoms we're treating is obesity. So you're going to see all healthcare providers becoming obesity doctors, not necessarily obesity medicine specialists, but they'll all be obesity doctors, because just to run through a litany of different types of providers and why obesity is going to make a difference to them, or why weight management is going to make a difference for their practice, is that if you think about me as a plastic surgeon, the reason we got started in weight management is because we had patients coming in for tummy tucks or body contouring procedures, thinking of them as weight loss procedures, when in fact they're really just body contouring procedures. Like your best results is after you've already lost the weight. We're just removing excess skin. We're not really reducing your weight. That's not the goal. And so we had patients coming in whose BMIs were really high. They were really overweight. They weren't good candidates for surgery. So rather than turning them away, our nurse and nurse practitioner suggested we start a weight management program. And so we started a weight management program even before the semaglutides and the Ozempics were really available. So we were offering coaching and phentermine and things like that. And we can talk more about the automation, but you're going to get a lot of patients from obesity issues. So that's why it's so critical to automate it, to make sure you're getting the best outcomes and that you're not letting anything fall through the cracks, and you're staying within your processes. And there are a lot of manual aspects of trying to run a weight management program, whether it's the monthly subscription charges, or the dunning when the credit card fails. And so that's why automation is so important, to minimize the amount of I guess, wasted time of your office staff. But then also other types of providers that are going to be getting into this is that if you think about acne, one of the most common causes is obesity. That's why dermatologists are going to start off on weight management medications. We even have providers within our DoctorWell network that are doing this, that are dermatologists that are offering this, but also OBGYNs that are treating fertility. One of the most common cause of infertility, underlying cause is obesity. A urologist, most common cause of erectile dysfunction is obesity. So that's why you're going to see all these different providers getting into weight management and, again, treating the underlying cause of whatever ailment or malady they were treating before, treating the obesity. Now, other people are going to treat the underlying cause of the obesity, which is the food supply in America and our diet. That's great. We need to do that in parallel. But at the same time, we're going to need all hands on deck with all providers, all types of providers from all different backgrounds offering weight management medications. And then we bring that automation to them as the DoctorWell platform to help improve their processes within their practice.
Well, that I as I'm hearing that, and I'm in a fortunate position. I get to hear a lot of hosting various podcasts and webinars. I'm hearing a lot about this. This is really it was brand new to me when the first podcast I did, and I said, wow. Every time I hear another dimension, but I think the one thing I've heard is this paradigm shift to what I would in some practices I would say they call it holistic wellness. Maybe we talk about comprehensive wellness, where it's not just about, as you say, dealing with the symptom, dealing with the issue. It's about what can we do to be part of a plan that, I guess, if I was looking at it, that was mind, body, and spirit, was the whole gamut. And it's
No
just
question.
it's just such a great it's a great shift in, I think, in an industry that's been known for being more target oriented rather than comprehensive care oriented, if that makes sense.
Yeah, and it's been so much fun for me because as a surgeon, when you operate on somebody and they wake up and they're, at least as a plastic surgeon, a cosmetic plastic surgeon, they wake up with perkier breasts or a flatter tummy. They see the results, they're excited, it's instant gratification. But there's only so many of those operations you can do in a week. Whereas weight management, there are so many patients who are overweight or obese, and so you can really help like hundreds of patients a month. And it's really incredible. And like, what do we go into this for as healthcare providers or as doctors? You went in to help people, and so you're really helping so many more people with these medications. It's so satisfying and such gratification for the patient and for the provider.
Yeah. Yep. I heard another plastic surgeon was saying, a woman who's had a child, gained a lot of weight, things have changed. She looks in the mirror and says, "I'm not familiar with this person, and I've lost confidence in myself." And I think, wow,
Right.
that's it. I mean, that's part of what we're doing here. Is his confidence is a big deal. There's a tipping point in any type of practice or service, I guess. But I love the idea, though, that we're not. It's about how can I make a difference that's visible on the outside, but also transformational on the inside.
No
Yeah.
question. It's definitely helping them on the inside as well.
Yeah. So let's go back to the automating weight and wellness programs. I'd love to hear from you about what inspired you to develop an automated approach to weight and wellness programs. And specifically, how does it improve patient care and practice efficiency?
Well, the reason we decided to realize that there needed to be a solution for this is that, as you mentioned, I had a price transparency company, BuildMyBod Health, and the idea there is we were placing price estimators within a provider's website. The consumer could come and check pricing on insurance-based services, but also cash pay aesthetic services. And so it was a natural progression that if the patient was able to check pricing, but only after they provided their contact information, so a lead for the provider, that evolved from checking pricing. Well, then I see the price. Well, maybe I can purchase this non-surgical services. So that was the next step as we implemented e-commerce. And then providers were asking about offering subscriptions through the price estimator for Botox and things. So we extended it to include subscriptions. And because we had built out the whole subscription model, once we realized that we had a lot of patients interested in our weight and wellness program to get access to semaglutide and tirzepatide, the active ingredients in Ozempic and Mounjaro, respectively, we were getting it from a compounding pharmacy, and these were monthly subscriptions for these medications because the dose goes up each month, that we said, well, we can't manually process these subscriptions each month. What are we going to do? Oh, we have this company already that processes subscriptions. At the time it was BuildMyBod Health or Build My Health. And we have since rebranded to DoctorWell, and we've used that platform. We've pivoted that platform, still offer price transparency, but we've pivoted that platform to handle subscriptions for weight loss medications, but all types of medications that are available through a compounding pharmacy. And what we've essentially become is what we call a provider to consumer platform, PTC, as opposed to direct to consumer. So with direct to consumer like Roe or Hims, patients would go to the website, and those companies would make it very easy for the patient to fill out an online questionnaire, get access to medications. But the only problem was that they then only have a relationship with a website. So we're taking all that technology that makes it easy for a consumer to fill out questionnaires online, to automate those monthly subscriptions, and we're putting it all in the hands of the provider so they don't have to build it out themselves. So that's why we're provider to consumer platform, and now the patient has a relationship with an actual provider or a provider's practice. So that automation was really critical of what we found in our own practice. And so we've expanded that to over 175 providers across the country now using the platform to automate their weight and wellness program. And so different aspects of where you need to automate, the different pain points. So first off, the patient can have an in-person consultation, certainly a virtual consultation, but something that has actually allowed as a primary form of consultation is something called an asynchronous consultation, meaning that a patient fills out a form online, and then seconds later, minutes later, hours later, a provider reviews that. That's why it's asynchronous, not at the same time. So we've developed the part of the DoctorWell platform has this asynchronous consultation where you can put a link on your website, or you can have a link on our provider finder page where the patient clicks on it. They fill out this whole questionnaire for weight or for hair loss treatments or for erectile dysfunction, whatever the area is. They fill out a questionnaire about that that's hosted by DoctorWell. After they complete that, the provider gets a notification in the back end saying that there's a consultation for them to review. So if you didn't have our platform to do that, then maybe your office would manually create a DocuSign, maybe, and then you have the patient fill it out, and then somebody has to review it, and then, move it around to a different folder for the provider to review. Well, with us, the provider just goes in and they can review it all. The patient's already filled it out. Then the other pain point that providers were dealing with when it comes to automating weight or any type of wellness program was that the charges, the patient would sign up for a medication, they would you'd have to get their credit card over the phone, and then you have to hold it and then charge them each month. But that's actually something that's in most cases that's not allowed by Visa and MasterCard when it comes to high risk services like medications. They actually have in their terms and conditions, Visa and MasterCard have it in their terms and conditions that if you're processing a no card present payment, obviously the card's not present because you just got it over the phone or you're just holding it on file, that if you process that for a medication, that violates the terms and conditions of Visa and MasterCard, and they can shut down all your Visa and MasterCard processing. People don't know about it. Doesn't mean it doesn't happen. Doesn't mean it's not their law according to their terms and conditions. So you'd have to find a high-risk payment processor. We offer a high-risk payment processor through our platform, so you don't have to worry about that. Then the other issue is that you would be manually charging these credit cards each month, again, against the terms and conditions of Visa and MasterCard for these high-risk services. We automate that, so we're charging that card every month automatically. The provider doesn't have to worry about it. Then the next manual process that they'd have to deal with is that they would have to find a compounding pharmacy, fill out an application for the compounding pharmacy, get the credentials for the login portal to order meds, then navigate the portal. They don't have to worry about any of that. DoctorWell has automated that as well, that whenever the patient signs up for a medication and each month they're charged, our system auto generates a prescription in the back end of the platform where the consumer can go in, review that, not the consumer, the provider can review that prescription and click submit, and then it's automatically electronically routed to the most appropriate compounding pharmacy, and then the meds are shipped to the provider or to the patient depending on what the provider chooses. So that's just a few examples of what you would have to do manually if you weren't working with us versus the automation that we bring to the table.
So if I'm looking at this and thinking, okay, this sounds interesting. So what if I I hear what you're saying about the pain points being obviously the time and how much you have to invest in it. Certainly the whole billing process and the challenges around that. And then the accessing the meds and then the distribution and shipping of all that as well. So for one of the big things with in this business, as I mentioned before, we're talking is trust, obviously, so I have a trust of my patients, and they know us, and I'm going to be introducing DoctorWell into this mix. What are they going to see online? What are they going to see about DoctorWell, and how do we? Can you just speak to how DoctorWell can build on the trust you've already established?
Certainly. So that's the thing that's great about this is that we're helping just augment the healthcare provider's own processes. So yes, patients can find the provider through the drwell.com provider finder, but the main thing we're working with is the provider's existing patients. So they're seeing the patient however they want, whether it's virtual, in person, or through that asynchronous consultation. But if they fill out the asynchronous consultation, it's got the provider's logo at the top. So it's white labeled for the provider. But then their whole interaction is with the provider. So whenever it's time for them to sign up for the medication, then the provider sends them a link through the DoctorWell platform. The patient gets that link either via text or email. They click on that link. It brings them to a page, again, with the provider's logo on the page. So they think they're still within the provider's ecosystem. And then they see the package that they're signing up for. They put in all their credit card information. It's through the drwell.com website domain. But again, it's got the provider's logo at the top when they first land on the website. So they fill out, put in their credit card information, and they're charged. And then the emails they get to notify them that they've been signed up, it's got the provider's logo in there. But then also, even on their credit card billing statement, it'll say DoctorWell asterisk and then the provider's name. So we're always bringing it back to the provider. We're always making it clear that, yes, we may be processing the payment, but your connection, your relationship is with the provider. So we're making that very, very clear that, again, as a provider to consumer platform, that's where it's all about, is that we're just sort of managing the automation in between here, but you're still the patient and you're still connected to that provider. DoctorWell is not practicing medicine compared to the direct to consumer website, where everything is in connection with the website. They never really even know who their provider is. And if they have a problem and they need to follow up, chances are they're not going to be able to connect to that provider. But even if you could connect with the provider through the direct-to-consumer website, they're still contracted providers. They're still independent contractors. There's just not the same level of accountability, and it really all boils down to that one word, accountability, that the patient, the provider has the accountability with DoctorWell because that's the relationship is between the provider and the patient, whereas there's no accountability with the direct-to-consumer website. That provider is an independent contractor. They're paid to see as many or review as many asynchronous consultations over the course of an hour. So they're not connecting with those patients in the same way. I mean, like, there's no way to even argue that they are.
Yeah, I think, you had me on the continuum of carrying my brand. Each practice we've invested heavily in our brands. We value who we are and why we matter. We communicate that. We do a lot of marketing to support that, build that out. And what I hear you saying, what I heard was a term that jumped to mind was that DoctorWell becomes a trusted partner. And to my customers, my patients, it's our trusted partner, DoctorWell, helps us help you have the best possible experience in healthcare and wellness that we can offer. And so it just really becomes a continuum. It's
also it's a trusting name. It's DoctorWell. It's not
Yeah.
Roe. It's not Hims. Not hers. It's DoctorWell. It's like, well, that sounds like a doctor, and they're all about wellness. So I mean, just even in the branding, there's trust there. It engenders trust. And yeah, no, it's all about trust. Like I said, that continuity of care and that accountability. You can't get that with an independent contractor that you met through a website. Almost sounds sketchy. But if you're connected to an actual medical practice, you've got their phone number, you know where they're located. There may be, probably a brick and mortar that you know where you can reach out to if you're having a side effect, because that is common with a lot of these medications. Doesn't mean that they're bad, but yeah, there's side effects. So you need somebody to talk to get help for it.
Yeah, and I think this is the new normal that I always say I'm a leadership coach and work with a lot. I don't work a lot in a couple of doctors, but most of my work has been in C-suite executives and entertainers, as a matter of fact. But but this whole idea of offering something to somebody where it has to. There's so many opportunities, so many offers, so many things out there. There's this, and what I like to say, like, how do I take 80% of my time or my client's time and help them focus on the 20% of what they're great at? And that, I think, is really what we're really talking about. Is this an area where there's efficiencies to be gained while protecting the integrity of the relationship with the patients, but still executing transactionally at the highest level possible? Does that make sense?
Yeah, absolutely. No, that's definitely what we're doing. I mean, we're definitely recognizing all those inefficiencies because as a plastic surgeon, as a doctor, I'm in the trenches too, and I see where those inefficiencies are. And so we're providing this layer, and layers sometimes is a bad connotation that you're adding levels of bureaucracy, but we're really making it so much more efficient. I mean, just think about the office staff not having to track down some patient because their credit card failed on their monthly charge. I mean, that's called dunning. And that takes up a lot of time trying to track them down. And so that's one other example of the automation we provide, efficiency we provide, is that if a patient's credit card fails, our system will automatically email them to let them know that they need to update their credit card if they want to get their medication. And then they do that all behind the scenes. The provider's practice doesn't have to follow up with them at all. So that's just one other example of how we're bringing that efficiency back to the practice. And it's really fun because it's so great to see how much it's making a difference in the lives of our providers. I mean, they're like willingly giving us testimonials now. It's really great to hear.
That's
Whereas
awesome.
with price transparency, it's still important and consumers love price transparency, but providers don't want to do it. And so, like, instead of me beating my head up against the wall trying to get providers to implement price transparency in their practice, this they're happy to do because they see how it really is helping them. And we'll still continue to insert price transparency into this DoctorWell platform as we go forward, but it'll be more palatable to the provider because they'll see in the big picture that these subscriptions are helping make their life easier, and then eventually they'll see the benefit of the price transparency.
Very good. Yeah, I thought as you're saying, the dunning. I said, there's a whole other strategy you can use. I mean, if you really want to manage the dunning on your own, there's Dog the Bounty Hunter is available. I mean,
exactly.
All day long you can get it resolved. It's just, and if you want to go right along, I imagine you can do that too. But I'm not thinking that's really the best place and time for a plastic surgeon or an aesthetic professional
Just
to be.
as an aside, exactly. No, there's much better ways to spend your time. As an aside, the term dunning, which not everybody has heard of before, it actually originated in the 1700s. And now dunning is about somebody's credit card fails and you got to get an updated credit card from them so the payments can go through. But how did that term come about from the 1700s? I mean, like, what were they charging back then? So obviously it's the term has evolved a bit, but it's a very old term, but once you understand what it means, it's like, oh, that word dunning just explains that entire process of credit card failing and having to track people down and having to get them to give you an updated, appropriate card, and then things work. I mean, it's so funny how that sprawling morass that you might find yourself in is distilled down all into one word from the 1700s.
Yes, yeah. A kissing cousin and relative would be a usury. It's about the same generation and age too. So, I'd love to kind of just dig in a bit to some challenges. We're talking about the sweet spot on the racket and what are some of the challenges that clinics might typically face when implementing automation in the wellness programs, and then obviously if we could speak to how to overcome those. So, just as our listeners are at this point as we're starting to unpack these things, I just encourage you to be. You're going to be able, where you've picked up this podcast, you're going to be able to go back and listen again, but to just try and capture a couple of things today that you could actually say, hey, I could go ahead and do this or start this. I think often we catch something like this and we take it all and if you're on to the next patient or the next situation or next problem. But if you have something, a little opportunity soundbite, something that you can say, I'm going to go, when I get off this, I'm going to do this to start something. Just really encourage you doing this. And sometimes it's things like this where Dr. Kaplan is going to talk about little things how they overcame it. That there's a in when one of the things we've heard a lot of is when we recognize there's challenges, when we identify them, all we have to do is reverse engineer those. And I think
Right.
that's exactly so. I just want to set that up with our listeners because we don't want this just to be another listening experience. We want it to be something that you can implement and
Sure.
move forward with that is a game changer. So, yeah, what challenges do clinics typically face when implementing, and how do they overcome them?
So, as far as the challenges they're going to face is just all the disparate systems that they're going to try to have to keep up with. So if they're not using our platform, then they are going to have to do, decide how they're going to do their consultations. That's fine. But then they're going to have to decide, okay, when we get somebody enrolled, are we going to put them on an Excel spreadsheet and then keep that up to date every day? Those are challenges they're going to have to deal with. If we're processing their payment, are we going to make them come in every week to do it, or once a month to process their payment? Which patients are not going to like that. And then when it comes to other challenges, specifically with weight and wellness, these medications, when you're talking about not just subscriptions but pharmaceuticals, you're going to have to deal with the challenge of finding the right pharmacy, a pharmacy that's going to deliver to your state, that's going to have the best cost of goods, that's going to have a certificate of analysis, that's not like sketchy, pharmacy that's only providing research grade meds that are not for human use. So you're going to have a difficult time trying to keep up with the pharmacy that's going to work for you and also that's not going to be too expensive. The other thing is the legal landscape keeps changing with this, whether, the relationship with the medications and the FDA. So we have a general counsel that's a pharmacist and an attorney that keeps us on the straight and narrow. And so you're not going to be able to keep up with all that on your own. So the bottom line is that while these weight and wellness programs are very lucrative and very satisfying for the patient and for the provider, there's a lot of moving parts that most practices are not going to have the bandwidth to do this on their own. And so that's kind of what we bring to the table, is that we're going to help you stay legal. We're going to connect you with the best pharmacies that have the best rates, that will be quick about getting their medication shipped out to you. And then, of course, just the technology aspect of what we're implementing to help you with automating all of that. And the asynchronous consultation, I can't stress that enough. It's not new, but it's new to all these providers. If you haven't worked for a Roe or a Hims, you never heard of if you haven't worked for them, you haven't heard of a asynchronous consultation. And it's crazy how in 32 states, asynchronous consultations is the only form of consultation you need. You don't necessarily have to have a follow-up. In the other 18 states, you need a follow-up, but still, even having the patients in those 18 states fill out an asynchronous consultation provides you not only a lead. That's the thing people have to understand, is that people are filling out these consultation forms, and that's not only a lead like a name and an email address, but it's a pretty qualified lead, because they're providing you with all of their medical information within this questionnaire. And so you're getting more information from this lead than you ever have before. And those are all the types of things where you're going to be struggling. Okay, how do I get more patients within my local area? And that's the thing with the asynchronous consultation, then being able to fill it out online, that even if you had to have a follow-up visit with them virtually in one of those 18 states, is still better. The point is you're able to connect with all of the patients across your state, not just in your zip code. And if you have state licenses in multiple states, then you're able to connect with all those patients in all those states virtually with an asynchronous consultation. So it really expands your potential as a provider. The other thing that we're finding is that we were talking about pain points and things that, people might struggle if they're trying to do this on their own. Well, the other thing is we have to keep in mind, a lot of the providers that we're working with aren't not necessarily a provider in a practice. They may be a PA that's working in an ER, but has the ability to practice independently and is wanting to do something outside of the ER. This is what we're finding now, is we're seeing people who are entrepreneurial, that are starting, for lack of a better term, a side hustle, that they're seeing if there's something else they can expand into. Like, it might be a side hustle initially, but it's eventually going to be their primary avenue of or primary vocation. And then we're seeing providers that are, typically insurance-based services, and they're struggling to keep the lights on. They're looking for some other opportunity that's cash-based services. And so that's what we're really seeing, is that those different difficulties, not only in running their practice, but difficulties in life and difficulties in their career. And that's where this DoctorWell platform is coming in to help them as well, because they don't even have to have a brick and mortar. They can just do all of this online. They don't even have to have a website. They can do all of this online through us, and they can really turn the corner in their life and their career and maybe not be dreading to go to work every day, not be miserable having to deal with insurance, not getting denied another time, that this is an all cash based revenue stream that can really transform their life. And that's why we've enjoyed it so much for not only us, but for all of our providers in our network.
You're talking about qualified leads and the value of a lead and all the, I think one of the things that I've heard in different podcasts is, we talk a lot in the marketing world, we're not experts in marketing, so we hire people to help us with marketing. And in this case, we're not experts in all these dimensions that actually support the journey with the patient. We hire those expertises. It's becoming just so much more important. I think the other side though is with these qualified leads, as you said, is just the power of the relationships that come from that and the potential for referrals. Because as you said, you're getting reviews, people are talking about it, there's value. There's an energy around that. AI right now is the big conversation and all that.
Right.
And it's amazing. It's just really in its infancy in many respects. But this direction of finding something that has a collective mass that's moving forward, that people want what you have. And I love how you're putting that. And I think looking ahead, and how do you see automation transforming medical aesthetics and wellness industries in the coming years? What does that look like?
I mean, this is just going to expand. I mean, I know I'm a plastic surgeon. We first got to aesthetic providers with all this, but that's where this is going. It's going to be every provider in America that's going to start offering these medications. And the obesity medicine specialists are going to be upset that people are getting on their turf. But the bottom line is there's just too many patients in America. I mean, it's 136 million Americans were in a recent JAMA study, 136 million Americans. Remember, there's 330, but 136 million Americans were considered candidates for these medications back when the only indications were type 2 diabetes, obesity, and heart disease. So 136 million Americans are candidates that are eventually going to seek out these medications. There's going to have to be a provider out there to evaluate them, and it can't just be the endocrinologist. It can't just be the obesity medicine specialist. That's why this is growing so much, is because it's going to help every provider to actually finally treat the underlying cause of whatever symptoms they were treating before. So that's where this is going. Is everybody's going to be on the bandwagon.
So yeah, I guess the question then comes down, where do you want to sit on the bandwagon?
Exactly. You want to get on it early. Exactly.
Yeah. And anything like that. But this is, I think it's important that, if I'm a practice owner and listening, I'm thinking, look, okay, you're giving, I can see the value in this. I see the incremental components that can add value to my place. I see some efficiencies. I like you. I'm trusting this. When we look at this from that standpoint, for somebody, what would be a barrier to entry for a practice owner, do you think, today listening to us? What would be a reason that they feel uncomfortable moving forward with this?
I mean, maybe it's the price of, are you talking about specifically with the DoctorWell platform? Maybe the cost of it at $7,500 a year to use the platform. So that's one barrier of entry. We do offer a different type of plan where it's no money up front, but then the cost of goods is increased on the back end. So we still have to generate our revenue somehow. So if you sign up for the free plan and then you're starting submitting prescriptions through our platform, the cost of goods is going to be more expensive for us to pay for our services. So you end up losing on the revenue overall. I mean, depending on how many prescriptions you're writing every month, you could be losing upwards of $30,000 in net revenue over the course of a year if you chose the free plan. So, but that is one way we've chosen to lower the barrier for people if they don't want to pay the $7,500, but they just have to understand that they will be paying for that somehow. And when we mention that to people, they're like, well, I think I'd rather just pay the $7,500 up front. That way I'm getting all that net revenue. I'm not losing it all in the additional cost of goods. Because that's one of the things is after the provider submits the prescription through our platform, we then know what the prescription is for. We know what the cost of goods is for. So we take the money out of what the patient has paid. Let's say they pay $500 a month for semaglutide. They submit that prescription. We know what that semaglutide dose is going to cost that much. We pull that out of that $500 and we pay the pharmacy directly. So because we're paying for all of our providers' cost of goods directly to the pharmacy, we have this bulk purchasing volume discount that we're able to pass along to the provider. And then we send them the net revenue. They don't have a compounding pharmacy bill at the end of the month. But if they choose the free plan where the cost of goods is going to be more, because that's where we're collecting our service fee, then they're going to end up having a lower net revenue. So that's what the provider has to just balance that. But yes, we're trying to lower the barrier to entry for the platform. But as far as big picture, what's the barrier to entry for weight and wellness? You might feel like, well, you don't know a whole lot about that, and that's fine. But that's another thing that we provide. We have a chief nursing officer that helps all of our practices with all their clinical fundamentals, like teaching them about all the things they need to know about with the different medications, whether it's the peptides or the weight loss meds. But the chief nursing officer helps them with all those clinical questions they may have about the meds, about the side effects and things like that. So we're basically just trying to bring everybody from you having to start on your own and having to figure this all out on your own over months and years to throwing you right in with all of the necessary information and equipment and technology that you need to get started right off the bat. So I definitely can see people's barriers they have in their own mind, but that's what we're trying to do is break down all those barriers to give you the education and the technology, and even the financial benefits of offering the platform the way we are with these multiple plans.
Okay, that makes sense. I think that's the, I'm just as a somebody listening there, where's the entry point? One of the things that comes to mind for me is, calculating. Obviously there's two alternatives, the free or the one annual fee. Is there anything on the website that helps me to develop out what I might need to look at for a spreadsheet to kind of calculate what my return on investment might look like with this?
Right. It's not on the website, but it absolutely is part of the demo that we provide to our providers. So like if you go to the website, DoctorWell.com, and you go to book a demo, we absolutely break those numbers down for you. We show you, like, if you look at the average number of transactions per month for all of our providers, which is 17 and a half subscriptions per month, and you look at what that would generate over the course of a year, gross revenue and net revenue. And then we show you what it looks like if you do 25 transactions a month, 50 transactions a month. And then we show you that the difference between the paid and the free plan and how the net revenue decreases with the free plan because of the increased cost of goods. So we spell that out all very clearly in a PowerPoint presentation as part of the demo. Absolutely right.
Excellent. Yeah, that's I'm sure that you just got a whole bunch of people wanting to have a look at that. So I heard that.
Exactly. Good.
I heard you say that was in the demo. So
Yeah.
we are getting
Well,
close to the end of our time, Doctor. I just want to put out just a wide open question to you. Just any closing thoughts before we wrap up today?
this is the provider to consumer PTC. If you've never heard of it before, it's because we made it up. But that is the future. It is the future segment. It's a new segment in the healthcare economy. And it's so clear to me because DTC is great in the sense that it has lowered the barriers of entry for consumers. It's made it easier for them. It's made the technology easier for them to sign up for different medication subscriptions. But it's ultimately it's going to be an irresponsible business model because you're just not really connected with a healthcare provider. Nobody's following you, and that's where PTC goes. And so these are just iterations. You started with search engines. Now you've got AI Chat GPT, which is even better search engine. That's the same thing here, is that you've got DTC, which is great for lowering barriers of entry, but now that's evolving to a more responsible way of providing healthcare that's consumer centric and still increases access to care. And that's PTC, provider to consumer. So that's the future. You definitely want to get on the bandwagon now.
Thank you, Doctor. Well, as I say, our time is coming to an end. So thank you so much, Dr. Kaplan, for joining us today and sharing your insight with us. It's enlightening, exciting, and it's like, for me, it's like ... stay tuned, because I'm excited to see where this is going to go for you. You can reach Dr. Kaplan through, and I would recommend through DoctorWell.com.
Absolutely.
So that's where you'll see that. That's how you can connect with him. So DoctorWell.com. But I also want to take a moment to thank our listeners. We appreciate every one of you. And as I mentioned, a big thank you goes out to our sponsor, Equa Marketing, and who are experts in digital marketing for aesthetics practices. This is exactly what we've been talking about. If you're an expert in marketing and the evolution of it that is almost daily, that's awesome. If you're not, then sometimes you need to acquire some knowledge and skill sets that help support that part of your business. And speaking of marketing, here's our marketing moment for today. Do you know the number of new patients you received last month from Google organic marketing? Well, if you don't know that, it's really important to learn about that, because when those numbers are sitting there, And implementing call and patient tracking is a huge opportunity in businesses that often just gets parked. So speaking of opportunity, I just want to remind you of that free digital marketing consultation I mentioned at the beginning of the podcast that's being made available to you to help with your digital marketing planning and activation. So you can go ahead and book that free consultation through www.businessofesthetics.org/MSM. You'll find a link where you've picked up this podcast. There'll be a link for this as well. So whenever I get an opportunity like this, or even, and what Dr. Kaplan is showing us, I always ask myself two questions to consider the opportunity. The first question is, what's at risk for me to do this? Well, in both cases, it's time because the demo's free and this consultation's free. And I think the second question is probably one more significant today, given what we've been talking about. What's at risk not to? What does the future look like? And are you going to be, as using Dr. Kaplan's reference, are you going to be on the wagon or chasing it or trying to find it? And I think today we've set up an opportunity, hopefully with the marketing, you'll take advantage of that. I know that from what I've heard, folks find great value in that. And I know that this demo with Dr. Kaplan would be of huge value, given what we understand what's happening with the industry. So just a reminder, if you like our podcast, please share it with your friends and colleagues. What a great opportunity to set somebody else up for success. And also, please don't forget to leave us a review. We love reviews. So thank you for the privilege of your time. And on behalf of Dr. Kaplan, wishing you all an amazing week ahead.